The health and safety of all staff at the General Hospital and other health facilities will be prioritized as part of the thrust by the Ministry of Health to prepare for the possibility of a second wave of COVID-19. That assurance by Director of Hospital Services, Dr. Carol McIntosh. Dr. McIntosh, who was a guest on the weekly health program The Next Chapter, said staff care, frequent testing, and monitoring will be the order of the day. The ministry has been conducting COVID-19 tests for all members of staff at the General Hospital to ensure they have not been exposed to any variant. In 2021, the ministry was forced to operate for months with limited staff as several nurses and healthcare workers tested positive. Dr. McIntosh commended healthcare workers for doing an exceptional job in ensuring that operations continue.
So one of the things that we're doing, we're testing all of our hospital staff.
Great.
One, to see, do we have the Omicron? Do we have COVID?
Mm-hmm.
Okay. And if you do test positive, we send you home.
Right.
We also follow up with you. We also have the kits available that if we have to send you home and perhaps you have hypertension, diabetes, or as myself, a little bit overweight, some of those different comorbidities that impact further when you have COVID. We give you the kit and the follow-up.
Right.
That's what we're doing for our staff because it's important to protect them because we can't have COVID in the hospital because our patients would succumb. And the education, and this is again where Dr. Donald, her team, working with nursing to provide constant reevaluation about PPEs and how do you manage the PPEs, as well as just the education about what do you do.
The ministry is also working to update the COVID-19 protocols at the hospital, and Dr. McIntosh reiterated the importance of vaccination in the process of curbing the spread of the virus.
You're saying vaccination and booster. Now, there's no mandatory. We're just saying education and tools. This is another tool to help you fight a disease. Just as we give you tools for aspirin, we give you antibiotics, etc., this is another one. So there should be no question about, I need this because I need to protect me, who in turn will protect my staff, who in turn protect my patients, who in turn will protect my family. So we're doing a lot of that. And then, as you said, teams are starting out for us to go back out into the community to do testing and vaccinations.